So this week we're going to be discussing vessels, blood vessels. But let's start with the story first, because I think stories are important to help understand what's happening in different bodily systems. But in anything, storytelling is really important. So one time, many years ago, actually, so I used to be the director of a private residential fitness club. And this club was located in Las Vegas, Nevada. And I was the general manager of this private residential fitness club, very upscale community for 10 years. Only people who could use the facility, the people who lived there. So we had a lot of really affluent people who had access to a lot of great health care, but often were not knowledgeable about their own well-being, even with having a lot of access. So I had one gentleman who wanted to do some personal training with me, sat down with me in my office, and we did our intake. And an intake, I'm taking blood pressure, I'm doing pulse, I'm looking at all the different metrics, vital signs, waist to hip ratio, all these different things, these big indicators that let me know person is moderate, low risk, moderate risk, high risk. I took his blood pressure manually and I noticed that his blood pressure was really high, well over 130, over 85. And I said, "Oh, it looks like you have, I've taken your blood pressure several times. Has your doctor ever diagnosed you with hypertension, which is, high blood pressure?" He goes, "Yes, and I've been on medication." And I said, "Have you been on beta blockers to help with your high blood pressure?" And he goes, "Yes, but I took myself off of the medication without my doctor's consent." And I said, "Well, this intake is done because I can't work with you without your hypertension being controlled through at least at the beginning medication. And you shouldn't get off your medication without physician clearance." And he said, "Why?" And I said, "Well, because," and this relates to, again, what we're going to be talking about with blood vessels, is that the symptomology for high blood pressure is essentially asymptomatic. So I could line up 20 people and I wouldn't know which person has high blood pressure symptomatically. Now, I may look at someone and go, there's a possible likelihood, especially if the person was overweight or obese, and speculate, but I really wouldn't know. I'm not seeing any physical manifestations in terms of like outward signs, symptomology wise, of high blood pressure. It's often called the silent killer because when not contained, and certainly with this gentleman, I told him I could be working with you and then you could just have a stroke out of nowhere, which is one of the big consequences of uncontrolled hypertension. So, all this to say that when we talked about the heart, we're talking about uh, blood vessels. All this is interconnected and related. So, when we first talk about looking in terms of blood vessels, it's important to know that this is essentially the highway system of your body for the flow through valve system. Okay, which really critically important to understand that this is our flow through valve system. And this system relies heavily on the fact of having, I don't want to say clean, but having open valves and having less viscosity, and less gunk, more flow through. Okay. So this highway is primarily composed of arteries, veins, capillaries. Right? Arteries carry blood away from the heart, veins bring it back to the heart, and our capillaries, which are really connector small arteries to small veins. It connects small arteries, small veins, and creates essentially like a circuit system there, very microscopic for that. And it serves mostly like the cellular highway needs there as well. So that's a really important concept to think about. Another important concept is to think about the endothelium, or the lining of the blood vessels. So another thing to think about here, again, you're going to get a lot of exercise discussions with me because that's my background, but also it's one of the best ways to understand the almost devastating effect of lack of flow through. And when we get to the lymphatic system, exercise becomes incredibly, because it's not a pump system, it's a manual pump system. And we'll get into that. So when we talk about the heart, our muscular pump, the flow valve highways of blood vessels, endothelium um, lining of blood vessels are important. Why is this important? So if we look at pathology wise, when cardiovascular disease, which we've talked about in D2L, and sorry, we talked about in Yellow Dig, and we've had a great discussion on that, is based off of a lot of a larger umbrella aspect of things. But one of the issues is hardening of blood vessels, and particularly hardening of the endothelial lining of blood vessels, stiffening of those blood vessels. Right, and so we want those blood vessels to be flexible. We want them to be pliable. We want them to be strong, but have good mobility. Now, what does this also sound like? Sounds like your for your joints and your body as well. Your blood vessels, heart, all works very similar to this, especially with the flow valve highway. We want that highway to be flexible, but yet strong, to have good flow through traffic. We don't want it to be clogged up, right? We don't want to have massive amounts of viscosity and um, and gunk in there that it causes less flow. Less flow is less oxygen, less red blood cell production, which ultimately leads to clogging of arteries, can lead to a heart attack for that. So, what do we know about how to keep our blood vessels uh, nice with nice flow through and not as stiff? We know that exercise is a tremendous, tremendous facilitator of flow through, right? And that happens through vasoconstriction, opening of blood vessels, vasodilation, closing. When we have better flow through, we have better vasodilation. All right. So we have better flow through. When we have less stiffening, we have better flow through. Exercise promotes increase in flow through, less viscosity. So you're getting more red blood cells flowing through a flexible yet strong, less stiff um, blood vessel component here. So it's really important to understand that that is a big part of it. Exercise, specifically cardiorespiratory exercise, is a huge component when it comes to blood vessel health. Now, we do know that, which is kind of odd in some ways, that resistance training does cause some stiffening, a little bit of endothelial lining. But it's generally healthy, but it can cause something. So the combination of resistance training plus cardiorespiratory endurance creates a really powerful mechanism for creating flow through in blood vessels. So again, I can't state how important this is for this. So we'll get into a little bit more of this as well as we continue, as we talk about angiogenesis as well. But exercise for the general aspect of it creates great flow. Great flow creates less viscosity, less gunk, creates more stable blood pressure. All right. Force the blood against exerting against the walls. It creates a much more seamless experience as blood is traveling through the body, venous return to the heart, tracing the blood all the way through the different atria, ventricles, out to the body. Critically important that exercise is a pretty large portion of for that. All right, so talked about arteries, veins, capillaries, the endothelium lining, which is incredibly, incredibly important for that. So we'll move on to a little bit more as we talk about capillaries here. So they're essentially exchange vessels. So where gases, nutrients, waste, hormones pass between blood and the soft tissue. Um, and so it's really important, again, with capillaries, that exercise is a big part of this because we know that what happens with exercise is we actually create more capillaries. We have capillary density. We have, much like what happens in our brain, neurogenesis, we have more neurons that are built through exercise. The angiogenesis is a very similar concept, but with blood vessels here. So that's one of the most beautiful things about being physically active is not only creating better pathways, but creating more pathways, creating additional oxygen carrying capacity components within that. And capillaries are no different for that. So we know that exercise literally impacts every aspect of the body, all the way down to the molecular structure of a person. So it's really, really important that this is incredibly important concept. Again, I like to teach exercise with the anatomy because it explains it in a way that is so incredibly important. All right. So again, as I move through this, there's lots of different layers to discuss, and your slides are going to be a great way for you to get some more of the nitty gritty, some further things to go into here. But I want to give you kind of the basics plus exercise point of view here. And then we can wrap this all up together through our discussions on yellow dick. So many different ways to go about learning content. So blood pressure, critically important here. So blood pressure essentially is a big part about pressure, flow, and resistance. Okay, it's really important to understand pressure, flow, and resistance. We want less resistance. The more resistance there is in blood pressure, right? So the less flow we're going to have there, decreases the flow and builds up pressure. So it's really important that we understand that here. So this is essentially understanding the process of hemodynamics, right, which is the physical principles of blood flow based off of pressure and resistance, right? So if we increase our difference in pressure, increase the flow, blood flow speeds up for that, okay? But if you look at it also another way, if the resistance increases, blood flow decreases. So obviously we want to have our pressure in a place that it speeds up blood flow and doesn't decrease it. Because over time, as blood flow is decreased, ends up causing much more pathological issues, which leads to hypertension, coronary artery disease, cardiovascular disease as a larger umbrella for that as well. So again, blood pressure is really the force blood exerts against vessel walls. So the force blood exerts against vessel walls. This is typically measured. Now, there's lots of ways to measure blood pressure these days. When I was learning how to take blood pressure, it was all manual through a sphygmomanometer. Okay, so, and this is the device, and certainly many viewers, you're going to be nurses, other healthcare professions. You may be taking blood pressure quite a bit. Nowadays, you can do it electronically. In fact, as I do some caretaking for my dad, he has a cuff, just puts on, it's done electronically. I push a button, lets me know all the information. But I think it's often really important to know how to do manual blood pressure. So the sphygmomanometer, you're looking at millimeters of mercury on this here. And this is recorded through systolic pressure, diastolic pressure. So systolic pressure is ventricular contraction. Diastolic pressure is ventricular relaxation. So when you're doing blood pressure, one of the things I always loved about doing this is you're pumping it up, and then you're listening for that carotid cough sound. The first time you hear that sound, the beating, and then you're listening for when the sound goes away. That's the beating, systolic, diastolic, when the sound goes away for that there. So blood pressure is really important, really critically important. Again, as I talked about what happens with that story that I talked about in the beginning, blood pressure is nothing to deal with. Because it's asymptomatic, essentially, you can just see a lot of people walking around and not know if they have high blood pressure. It's a critically important pathology to understand because high blood pressure leads to such devastating effects. So it's really important to understand that. So it's important to that this stiffening of the arteries, endothelial cells, blood pressure, understanding blood flow, viscosity, all these things are really important. So what are some other issues that also occur from this? So some will be arteriosclerosis, which is stiffening of arteries due to deterioration of the elasticity. The artery walls, again, this is a lot of endothelial cell lining or blood vessel lining. That lining stiffens up often through lack of exercise, poor nutritional habits. You also have atherosclerosis, which is a buildup of lipid deposits that become plaque. This is a lot of what you see with cholesterol, low density lipoproteins. This type of cholesterol contributes to plaque buildup, whereas high density lipoproteins contribute to taking away plaque from the arteries. So when I do an intake with a client, And obviously, I'm not doing blood panels or anything like that. But when clients do blood panels and they know that information to relay it to me, I say, listen, um, if you have LDLs are really high, let's say 110 or over, that's a risk factor, a high risk factor. However, if your HDL is over 60, I believe it's over 60, it actually cancels out that risk factor. And what causes you to have higher levels of high density lipoprotein? And you can look at it as LDL being lousy density lipoproteins, or HDL being happy density uh, lipoproteins. It's a good way to remember it. Is that exercise plays a huge role in this. Consistent exercise, cardiorespiratory endurance for the purpose of for blood flow for the heart and vessels increases HDL significantly, significantly. In fact, if your HDL can be in the 80s, 90s, you are doing fabulous. And you would literally just essentially eliminate higher LDL numbers for that. So we want to avoid arteriosclerosis and atherosclerosis. And how do we do that? We have to have flexible, pliable, yet strong arteries, elastic, more elastic. This helps through exercise, obviously, and creating more blood flow and taking away that plaque deposits that happen often through poor dietary choices and lack of exercise. Exercise helps to really buffer this and bring it together. So, another really important concept there. When we look at hypertension, again, which is chronic high blood pressure, generally over 130 over 80, or hypotension, which is chronic low blood pressure. Now, you can have some levels of hypotension due to the training effect, where your heart rate is lower. Um, but often this is not the case with most population. The kid had hypotension, it's chronic low resting blood pressure, usually caused by blood loss, dehydration, some anemia as well with that. Sometimes people will experience orthostatic hypotension. This is often due to being at high altitudes and your blood pressure drops. So there goes that altitude aspect again. Actually, I had a client who lives in California and Santa Barbara, but also has another home in Utah in the middle of nowhere, but at 9,500 feet elevation. And every time she goes there, she gets a headache. And one time she actually passed out. She fainted in her home and she had orthostatic hypertension for that. And I was talking to her a little bit about that. So, again, with exercise, we know that exercise contributes tremendously to lowering blood pressure, right? Increases more blood flow, right? Less resistance, less peripheral resistance, more blood flow for that, which decreases blood pressure. And the training effect is a big cause of that as well for that. So when we look at blood pressure, also important to look at heart rate with that. Now, we didn't talk about this quite a bit as much. I didn't talk about it within Yellow Dig, but it's important to note that with heart rate, blood pressure, blood vessels, reason why we stack heart and blood vessels together because they work together. But it's important to know that heart rate also benefits tremendously from the training effect for that. So what happens is, again, as we look at as the less the heart thickens, and specifically, especially the left ventricular pump where stroke volume occurs, it gets really thick, creates the accordion effect. So you're able to have more filling time. So the blood fills more and more, it takes longer time for the blood to fill, and a stronger ejection point out of the left ventricle for stroke volume. This slowing down also decreases resting heart rate. One of the greatest indicators of a high level fitness is resting heart rate. How efficient your heart, how slow your heart beats. Now, some people have slow heartbeats because they'll have like based off of pathological conditions that are causing that to happen. As long as there's no symptomology with that, with the training effect, it's actually a positive thing. Believe the lowest resting heart rate ever recorded is, I think, 26, and it was by cross-country skier, which is probably the best form of cardiovascular endurance or activity, cross-country skiing. but regular cyclists are regularly in the 28 to 36 range. An elite level of heart rate for general population, a fit person would be in the 40s, especially at nighttime because of the parasympathetic response, sleeping. If you're in the mid to low 40s while asleep at night, you have elite level heart rate for that. So something to think about it. Your average is generally your 60 to 100. Above that, we start hitting some serious problems at that point there. So again, just trying to link together how important these aspects are to each other here. So one last thing about blood pressure is also determined by three variables, which is cardiac output, the amount of blood that is produced out of the heart, not just the left ventricle, the total blood, um, blood volume. Sorry, got that mixed up there. But stroke volume is the amount of blood ejected out of the left ventricle of the heart, right? And so the cardiac output is also related to blood pressure, um, how much blood is pushed out of the heart total, blood volume, how much blood you actually have circulating through your body. Now, another cool thing about exercise is that exercise actually increases the amount of liters of blood in your body. So this was years ago. I remember when I used to teach this part of it in exercise physiology, but often people have 5, 6 liters of blood. You can move that up to 8, 9 liters of blood with just exercise. More blood, more red blood cells, more oxygen carrying capacity for that. Blood pressure is also determined by resistance to flow. All right, so resistance, blood pressure, and blood volume is regulated by the kidneys. So you see, as we keep moving down bodily systems, how everything works together. So except for the beating of the heart, the kidneys have the largest influence on blood pressure of any other organ with that as well. Some other aspects, when we look at peripheral resistance or R resistance, which is the opposition to flow that blood encounters in vessels away from the heart. That resistance hinges on blood viscosity, the vessel length, and the radius width of that as well there. So blood viscosity, high viscosity and flow declines, especially with dehydration and other pathologies that occur. Vessel length, the farther liquid travels through the tube, the more cumulative friction encounters. So the farther something has to go, the more friction will be that. Pressure and flow decline with distance. So something to think about with that as well. And then vessel radius, which this has the greatest control over blood flow. In those, when you talk about resistance, is the radius of that. So small changes in the radius, narrowing of the vessels, makes a large change in the effectiveness of blood flow. So again, this is also looking at vasoconstriction, vasodilation, constriction, narrowing of the vessels, vasodilation, widening of the vessels. When we exercise regularly, consistently, progressively, we have better vasodilation. The vessels open wider, promote more blood flow here. Amazing exercise. It literally just does everything. It's pretty cool for that. So these are kind of the high points that I wanted to make sure that we covered when looking at blood vessels, pressure, different things like that. It's really important. These slides will take you through a variety of other things to look at. I think one really last few things I want to talk about is really blood flow related to the skeletal muscle pump and also looking at venous return. So I see what's really important is when we contract our muscles through movement, change in body position, physical activity, exercise, we're promoting blood flow. You probably know this intuitively as you feel really stiff and you don't feel very limber and warm when you're just sitting for a really long time. But as you're more active and you move around, it promotes increase in blood flow. So that skeletal muscle pump system, the bones moving, the muscles attached to bones, the lever system causing that contraction helps increase blood flow with that. So it's really important aspect of venous return. So a very important aspect. So venous return, we know that exercise increases venous return for a few reasons here, right? When you exercise, your heart rate goes faster, increases uh, uh, the blood flow, increases respiration rate in the lungs, increases vasodilation, increased respiratory rate, increases that pumping system, right? The skeletal muscle pump. What happens is without exercise, you get a lot of venous pooling. That pooling is due to inactivity. When you have pooling, you're not getting blood flowing efficiently back to the heart from other parts of the body, and therefore you're not getting as much oxygen carrying capacity, decreases cardiovascular endurance, also contributes to stiffening of the arteries, veins, what we discussed before. So prolonged standing or sitting decreases venous return. And venous return also is something that has gravity related to it. If you're standing, it's much harder for blood to return back as it has to work against gravity coming back up. This is why RICE is really important. Rest, ice, compression, elevation, the E part elevation. If you lay down, put your legs up. Let's say you have a couch, you're laying down, put your feet up on the couch, increases venous return just due to gravity and change of body position. So it's really important for that. So muscular contraction is really important for that venous return. Again, another benefit of exercise for that as well. So venous return is something that I talk to my clients about quite a bit. And it's something that we don't take into consideration enough because it's really important that we assist blood flow back to the heart as much as possible for that. All right. So make sure you check out the slides as an additional information here. And I wanted to give you a more traditional style lecture. I will post this not only in D2L, but it will also be on Yellow Dig as well for you to consume. I'd love to hear your thoughts back about this. Again, going to hear a lot about exercise within this, but it's critically important that it is melded together here so you better understand the system. Because what happens in anatomy is we talk so much about chronic disease and what happens when these systems aren't working optimally. But we rarely talk about what happens when they do work optimally. And that is often a discussion about exercise and nutrition, obviously sleep as well, but exercise playing maybe the largest role in affecting every system top down to its max and creating a more optimal environment for that. All right, everyone. Thanks so much for your time. And we'll hear from me again soon.